Well, good morning, everybody. Everyone hear me okay in the back? Sounds good? Thank you. So thank you very much for getting up early and joining me and helping us get the healthcare track going. On behalf of AWE, I do want to thank their gold sponsors, IVRHA, CareXR, Xerox Company, HP, Metamaterials, PlugXR, and a big thank you to their titanium sponsors, Niantic, Qualcomm, and Unity Technologies. We have a great lineup today, few breaks in between, some very small minor schedule changes, but I'll be here with you throughout the day, and if you have any questions or need anything, don't hesitate to let me know. So kicking off today, I just want to talk a little bit about VR and healthcare in general, a little bit high level of my view upon it, but also how the industry has kind of been affected the last 2 years. So just briefly, a little bit of background about myself. I spent first half of my career as a systems sales engineer, learned RF engineering on the job, was trained as a mechanical engineer, and worked at a number of large organizations and some small startups as well, with a lot of overseas work since I left college. So it's been great. And then I got a dream job in 2000 with a large conservation nonprofit to be their global director of IT, and had the privilege to build out their global network in 40 countries and traveled overseas half the time, places like Madagascar and Liberia and Papua New Guinea. And was great until the financial crisis of 2008-9. Suffered my first layoff ever in April of 2009, and that's kind of what started this next journey that's been ongoing now for about 11, maybe 12 years. So I started a media company a little bit by accident, and in 2009, right as I got laid off, I was heavily getting into Twitter and Facebook at the time. And 3 weeks after being laid off, I ended up organizing what turned out to be the first social media conference on the East Coast. I had a friend colleague that organized one in San Francisco a couple months before that. But it got very lucky. PBS NewsHour filmed all day and aired a 20-minute piece that summer, and the title was something like, Twitter, is it a fad or here to stay? Just to put the timing in perspective, how long ago this was. And I did a number of conferences that year. I had a book come out on applied social media in 2010. And then I did what nobody should ever do. I launched a print magazine. But I'm a big fan of print, still am, but still to date, the only print magazine about social media. Had some good traction. We had global distribution, 20 countries, Barnes & Noble, named, thank you for the chair, that's great. And we were named one of the 15 hottest magazine launches of 2011. Only time I ever raised money, got burned really badly, never again. That's a whole different story. But that really kind of leads into the VR stuff. And I'm a longtime video gamer. Someone was mentioning yesterday, they started with Atari 2600, so did I. So I've always kept an eye on VR from a gaming perspective. And in 2015, 14, when the Kickstarter for Oculus came out, people started asking me about what's social VR, the intersection of social media with VR. And so I started looking at VR more carefully, and for 2016, 17, part of 18, just experimented, did some one-off events in different verticals, trying to see where the interest was. So VR and architecture, VR and defense, VR and entertainment. And we did our first VR and healthcare event in summer of 2017 in Washington at GW Hospital. And we had a good turnout, and there was some strong interest and excitement there. And so with the help of Walter Greenleaf, who did a remote presentation for that first conference, helped me put on a second conference that we did at Harvard Medical School in 2018. And that was, I think, a big success. We had 250 attendees. We had 6 tracks, maybe a couple too many. But it felt like a good moment for the industry. So I was trying to think through how to make this sort of sustainable, and I was interested in healthcare. I have background in environmental science as well. And so launched what's about 3 years ago now, formally IVRHA, so the International VR and Healthcare Association. And shout out and thank you to HP that was a founding member and an anchor member, helped bring some strong credibility. And we formally launched the organization in March 2019 at our third annual conference, and with 40 founding members, these here on the chart. And today we're about, give or take, 100 member organizations, and including startups, teaching hospitals, universities, primary care hospitals, trying to have the association representative of the healthcare ecosystem, and trying to bring all the different parties together that is necessary to be successful in healthcare. Really difficult market to go to. A lot of moving pieces, requires more than most startups need to do, which requiring efficacy of data, sometimes regulatory approval. But it's a fascinating space, and the stuff that's going on in virtual reality in healthcare is mind-blowing, and it's moving very fast. So, and something I've been talking about for the last couple of years is in my mind, this is a 20-year journey for the VR healthcare space. And I say that not to be discouraging, but just to bring a little bit of reality to the pace that the healthcare space turns. And frankly, actually, the last couple of years of the pandemic, I think, is a perfect demonstration of that. Sorry, we've been using video conferencing for 25 years. It's not like it was something new, but all of a sudden the world discovered Zoom and video conferencing all of a sudden, and a lot of companies, including healthcare, were forced to adopt it. But technologies have been around for a long time, and actually they wouldn't even paid attention unless they were forced to. So it's just strange how technology gets adopted quickly in some aspects of our economy, but not in others. And so another important reality, and maybe we can bring this number down to 98% or 97% today, but the vast majority of people working in healthcare aren't familiar with VR. They've heard of it now, and they've probably heard the metaverse, but what does it have to do with healthcare? They haven't tried a VR headset yet, so it's 20% of the U.S. economy, a huge amount. But that also makes it a very large amount to cover from an education standpoint. How do we train those physicians? And before you even train people, you do need to get them excited. You need to get them bought in. And once people have a good first VR experience, not Google Cardboard, something high res, and it doesn't have to be complicated. It can be, I put about 600-700 people through Fruit Ninja in 2016-17 because it only took a minute to play, but it helped people understand the potential. And so just to finish that, it's just going to take time to educate the marketplace and create opportunity, but it's happening fast. So 5 years, 10 years, I don't know. So the last 2 years, I say this not to be flippant about the number of deaths in the last couple of years, but for VR, for technology, the pandemic's been good. It's been good for digital medicine. It's been good for telemedicine, big time. It's been good for VR and AR, and it's been good for the adoption of technology in general by healthcare. I've heard, actually, through conversations the last 2 days, a lot of what I've been hearing is, well, it's not that the doctors and the nurses aren't excited about VR, but we can't get IT excited, or we can't get our foot through the door of IT, and how do we deal with the security issues, and how do we integrate into their network? And there's been more money put into digital healthcare in the last couple of years than probably in the last 10, 15 years. Including VR and AR. So going back to last year, and just this is not to be all-encompassing, but just to mention a few, XR Health had a $7 million raise, Limbix $9 million, Magically raised another $350 million as a down round. We'll see how that goes. Immertech, $6 million raise. Vicarious Surgical, $13 million. Also VR, $14 million. And continuing into this year, Applied VR had a big round earlier in the year. Realized Medical, a small startup out of Ottawa. Trip, a great application that I think a lot of people are familiar with now and coming about. Also, VR had another raise, not even just a year later. Rendeavor got a $2 million NIH grant, so there is some research dollars going to supporting startups. And so in comparison, just in terms of where we are, I mean, we're almost at the end of the calendar year, but compared to 2020, the amount of investment in digital healthcare total, VR, AR being a subset, over 100%, it's more than doubled. And came across this headline, this is just last month, from Frost & Sullivan Research Organization, that over 50% of hospitals, assuming they're talking about US only maybe, but are accelerating digital investments. And I've never heard of this quadruple aim, maybe this is a common term within healthcare, but enhancing the patient experience, reducing costs, improving health outcomes, improving the clinician experience. And I think this is pretty well encompassing, because as I think about the different areas that are being worked on within VR and healthcare, they pretty much fall into one of these buckets or more than one. One of the things that's been on my back burner, and now that we've gotten our book launch done and out of the way, is one of the things that we don't have a good handle on is what is the amount of revenue beyond the numbers I just mentioned that's been invested in VR and healthcare, and the amount of investment, and also what's the revenue been created. And I don't think it's not so much about demonstrating that company X has made $10 million or $1 million or $1,000. It is about demonstrating, are we increasing year to year? Is it a 50% increase? Is it a 25% increase? And I think some of this data will be helpful, especially for smaller startups that are trying to show investors, where the growth is and that there is opportunity. So hopefully it's kind of something we're going to try and do over the next couple months. And then another thing I'll mention is the industry is slowly coming together, facilitated by FDA and an association called MDIC, Medical Device Innovation Consortium. They have gotten a medical XR working group together that started, actually, I guess early this year. It fell out of a meeting that happened at the FDA in mid-March 2020, right after the pandemic hit. And there's about 150 people on the email list that come to the calls from different parts of the industry. Active people, maybe 40, 50, 60. We definitely need more participation that is spread across these 4 subgroups. And I'm leading the subgroup on terminology. So if you're interested in this, let me know. We'll get you on the email list and get you involved. So what's our focus for the last couple of years, for the next few years? Education, education, and more education. Late last year, more than a year ago, we did a free online event, and we had 47 different companies, most of the members, present what they were doing. All these are available for free on demand on the website if you want to learn more about different applications. Last night, this has been a project in 2 years development. We did our book launch finally, and I'm excited from the reception of it. We've got our 3rd annual conference in Europe coming up in Dublin in just 3 weeks. And we have our 6th annual conference in Nashville coming up in early March. And that's at Vanderbilt University. I'm excited about this. It's hard to believe that it'll be our 6th. And lastly, an event I started for fun back in 2017 called Virtual Reality Day, really just a day focused on public education. In 17, 18, and 19, it was an in-person event localized around the world, everybody taking place on one day. Scheduled it in November. It's always the last Saturday before Black Friday, and coming up with that in 2017 was trying to get people excited about VR. Maybe they'll spend some holiday dollars. But we have our fifth annual conference this year coming up in just a little over a week. It's free online. Everything will be on demand. If you can't make it, just sign up and you'll get notice about it. And that is it. And my contact information, I try to make myself easily accessible. You can text me, call me. Don't call me at 3 in the morning, please. But and have a couple minutes if there are any questions. Or it's too early. Everybody, I'm still on my second cup of coffee, but yeah. So we'd like to use the mic to record it. Lance.
Hey, Bob, thank you for the presentation and all the work you're doing for VR and healthcare. Lance from healthysimulation.com. We've been doing some surveys or seeing other surveys out there about utilization of digital or remote technologies over the past, 2 years. There was a recent medical simulation distance meeting that did some research that hasn't been published, but basically found that 82% of users who invested in these types of technologies found themselves wanting more after the pandemic, and they're going to keep it or they're going to expand. So we're doing surveys right now to try to figure out more about, where's the pricing models in terms of what has moved, and then also trying to better understand the outcomes of leadership in terms of their perspective of how simulation has, been helpful to combat COVID-19. So I'm just curious, have you seen in any of your experiences with the organization or anything, other types of research, not so much about just revenue, but about, leadership perspective shifts about what these types of technologies can do for their institutions?
I think it's probably a little early to still even generalize very well on that. Just from my daily experience and interacting with different organizations, it's university by university, it's hospital by hospital. The one thing that I have noticed that is it unfortunate, I guess, to a certain extent, but the organizations that I see moving fast with VR in adoption internally, product adoption, experimentation, is where executive leadership is on board and supporting it. Often it's one person in a department, experimenting. They got a small grant and they're trying to do it from the ground up and get excitement, but that's a really hard slog, especially within the healthcare system. I guess one example is I've been working with University of West Virginia University. Dr. Jonathan Sherman, who's in the book, he was at GW for 10, 12 years, neurosurgeon, trying to get them excited about VR, struggling every step of the way. Moved to West Virginia University. And I think he's the last person that would say he's an expert in the field, but now he's leading the entire university effort, not just within the medical school, but they've got the provost. They've got so much momentum now, and that's a large university. So it just takes one person, but they do have to be kind of in the right position and supported by the right people.
I got a question for you. I'm based in Bethesda, Maryland, which is home of the National Institutes of Health. And I'm just wondering, what role are they playing in promoting AR, VR, XR in the medical field? They're always ahead of the curve on technologies and medicines and so forth. So could you share with us what they're doing?
NIH specifically? I think, maybe 2-3 years ago, if you had asked me that question, I would have maybe reacted a little bit more positively and saying that they're making great strides. There's individual projects going on. There's only one very high-profile person that I know of that is active in the industry and participating, and that's Dr. Susan Persky. She has a chapter in the book. She's been very active the last couple of years. But off the top of my head and coming to mind, there aren't any others. Even at FDA, I think the FDA has a little bit more momentum. There's one champion there that is not necessarily its executive leadership, but it has done a good job of corralling people and getting different departments interested, and I would say have 20, 25 people across the FDA involved in one way or another. I don't know if I could even say that there's 20, 25 people at NIH, maybe under 10. Last question. Oh, or maybe I have 5 minutes, sorry.
Thank you, Bob, for all the great work. I'm Amir from Penumbra. Couple of updates. Applied VR just raised $36 million today, announced.
Wow.
Behave VR closed a $140 million program with a big Japanese pharmaceutical company.
Yep. I forgot that one.
Which is exciting. You might want to share with the public of the people that care about healthcare and XR being a part of it, that Penumbra, being a pioneer in healthcare as a medical device company, just in October 1st purchased Sixth Sense, the company that I founded back in 2007, with a very significant investment. After years of investment in healthcare, or immersive healthcare as we call it. And I would definitely suggest for anyone that cares about healthcare, as you've been helping us, to be aware that when a public company like Penumbra that is consistently growing, went public in 2015 at about $40 a share, now it's over $250. You have a company that revolutionized the process of removing blood clots from the brain and the body. Going back to the point that in 2020 we released the first VR platform in the healthcare space with FDA approval, referred to as named as the Real System, that is now opening for third-party developers to bring in other solutions and applications on the platform, and released in August of this year a mental health. That one, the first one in 2020, was for rehabilitation for PTs and OTs, and in 2021 we just released in August a VR headset for wellness and mental health therapies. My question is, do you know of any other companies other than the work we've been doing that actually release products? And products, I mean a platform that is not relying on Oculus headset or relying on Pico, actually people trying to release AR or VR solutions to enable a go-to-market strategy for developers in the space.
That are public companies?
Take XR Health, for example.
Yeah.
It's a small
You got 1 minute.
startup. Do you know any companies like Stryker or Medtronic or J&J? What are they doing in the space?
I don't have well, J&J, actually I can only say J&J a couple of years ago was on stage with also VR at Oculus Connect. They made some partnership announcement. I don't know where that stands today. I'm hearing through the grapevine, behind the door development at Anthem, at Abbott, and the other larger companies aren't ignoring it, but they're being quiet about it. That's as much as I know. But I will say there are startups, there are small companies that are putting products out there. They're not at the size scale of a Penumbra or Sixth Sense, but they're focused on their niche market. And that makes good progress. So I got 30 seconds, and Carly, I'll let you get the last question.
Okay, just a quick question for me, and thanks for the presentation. You mentioned a book a couple of times when you were answering questions. What book is this, and where can I get it?
Well, thank you for that last drop, Carly. That was extremely nuanced. Anyway, so we have Applied VR Healthcare book, 35 chapters, 66 contributing authors. We sold out of 3/4 of our stock last night with the launch. I've got one box left with about 10 copies. So if you would like one, you're welcome to come up to me throughout the day. And with that, we're going to move on to Brendan Hale, who just recently joined Penumbra, a company that is growing very fast and hiring the best talent that they can get in the industry. And he is the new VP of Health and Market Outcomes Research. Oh, okay, I'm sorry. Oh, there's a fight. That's not on my schedule. All right, so we're going to take a quick 5-minute break, change slides, and I'll make that introduction again.